Hey, it's Dr. Charlie Johnson, physical therapist, back pain specialist, and owner of PT&J. In today's video, I want to share with you why you should be less focused on what you've been told is your diagnosis, less focused on finding what's wrong with you, and more focused on the triggers and/or what makes your pain, numbness, or tingling worse, and what makes it better. So basically, how does it respond to movement? Really, the reason is because this will lead you down what I call the healthcare rabbit hole. In other words, get this first, right? So again, we talked about the various common causes of lower back pain: disc problems, arthritis, SI joint problems. Another thing you could throw in there that might feel like a back problem and cause pain down the leg might be a hip problem, right? So there's many things that can cause you to feel pain in that area, right? Many people first go down the route of getting x-rays, MRIs, or advice about what could this be, right? And while that's somewhat helpful, it's really not all that helpful. And the truth of it is that these things are really good at picking up all kinds of problems that may or may not actually be the cause of your pain, numbness, or tingling, and may have been there years ago, and now just because somebody's zooming in and looking for it, now the problem is found, right? And that's what you're told is your problem, but really it's just a part of the normal aging process. So the truth is that about 60% of people over the age of 50 will have some type of bulging disc, spinal stenosis, degenerative condition, and actually feel no pain. So get that the images are not all that helpful when it comes to the treatment and management of your lower back pain. It really doesn't lead you down a path such that you feel empowered and in control to treat it yourself. Instead, it often leads down a path of many failed treatments, various different diagnoses depending on who you go to see, right? So understanding who you go to see will determine what you get and what you're told is wrong with you, right? So, and oftentimes you're just left with various bouts of failed treatments, temporary relief versus a long-term permanent solution that's found when we start to figure out and solve this question and problem, all right? So with that being said, we want to focus on the triggers, right? And what do I mean by that again? I want to know what makes your pain, numbness, or tingling worse. What reproduces it? So we'll start with, I want to know, and the first thing anybody should know when it comes to trying to solve your back problem is what about it is reproducible, and what does that look like? So a simple exercise you can do at home is take like a piece of copier paper, fold it vertically, so hot dog style. On one side of the paper, you're going to draw a frown face and write worse. On the other side of the paper, let's do it over here for now because we're not there yet. You're going to draw a smiley face and write better. All right. So, start to think. Worry less about the diagnosis, right? But think back. For example, people with disc problems, right? I mentioned how they often don't like being in a bent forward position in the spine. Their back might go out on them more often when they bend forward. They're feeding their cat. They're tying their shoes. They're putting on their pajamas, right? They take a long car ride. So all things that, times when the spine is bent like this, that's when they might have more pain, numbness, or tingling. Again, don't worry about the diagnosis. Understand these diagnoses follow certain patterns, right? People with spinal stenosis on the other side, they might love being, in a bent forward position. Think about the shopping cart, right? But they hate standing or walking. People with a disc problem might love that, right? So again, get that there are patterns and certain triggers or, movement preferences within these diagnoses that are much more beneficial and helpful when trying to get to the root cause, all right? So, what I want you to do is just write all the things that make your back pain, leg pain worse. So again, it could be sitting, it could be standing, it could be walking, it could be twisting, it could be bending, driving, chores. So a lot of people might not like vacuuming or doing the dishes, stooped over, brushing your teeth. Let's see, what else? Sleeping, right? Getting out of bed first thing in the morning, getting up out of a chair, right? So all of those things are examples of things that could make you feel worse, or these things could actually make you feel better. So you go ahead and just write all the things that make you feel better right now. You can do that, it's fine. So maybe again, it's maybe you like sitting, maybe you like leaning forward on the shopping cart, maybe you like to wear a back brace, maybe you like heat, maybe you like yoga, right? List all of those things here and make sure that you list all the things that make you feel worse. And I really want you to spend some time on this. So don't just think a little deeper, right? So write all these things down and then think, well, what about sitting makes my back pain or leg pain worse, right? So maybe it's that, hey, when I sit on a recliner, That's really bad. So that's double worse, right? It's not a smiley face, that's a really big frown face, right? But when I sit and I sit more upright, maybe on my chair at work, well then I feel a little bit better, right? So what is it about walking? Is it a certain distance or a certain surface? What is it about bending? What is it about lifting? Is it a certain weight, right? So really try to break these things down. Don't worry about getting it perfect. Just start to really get in touch with your pain, all right? Right, so what we know is that picture like a light switch, right? If we can walk in a room and we can shut the light, we can turn the light on, so the light's on right now, right? Almost always you can turn the light off, right? So if you can turn something on, you can almost always turn it off. Therefore, if you have some things that consistently make your problem worse, you can almost always make it better on your own with some teaching from somebody like myself, all right? What you might notice is that this is sort of the world you're living in right now. After treating thousands of people with back problems, this is how most people try to heal, right? They have a ton of things. They're in a lot of debt over here. They have a ton of things that make their problem worse, and they have maybe just a couple things that they're not so sure what makes their pain better, right? So you can imagine, you can do all the exercises you want, but if you don't first change these things, and these things that make your back pain worse, right, and you don't flip the equation to do more of what makes you feel better and less of what makes you feel worse, right, then it's going to be really tough to heal. So get that, all these things that make your problem worse, those are things that are starting the fire. They're nicking the scab. They're continuing to keep things present, right, and keep you in pain. So what we have to do in the first step in healing is that we have to temporarily modify, tweak, and or change these things. So again, we can start to cross some of these things off the list. We can get you out of debt, right, such that then you're at least in a position where things have sort of balanced out, right? Then we can start to give you exercises on this side or specific movement strategies, right, that help tip the scale towards healing.